Well, good evening, everyone. This is Dr. Ellithorpe with Tustin Longevity Center here. We meet every Tuesday at 6 o'clock in the evening Pacific Standard Time, and we go for 1 hour. We are here to provide an extended service to our patient base and their families and friends, where we just have a informational for educational purposes. This is not meant to be personal medical advice. They are presenting questions about people they know or themselves, but this is on a first name basis, so we don't know who they are. And I'll give my best answer that I can to their questions. We have an email source, so if you get on our tlcdoctors.com and ask about our newsletter, and you'll get notifications. And on the notification for these visits, you will see a link, and you can type in your email question on the link here, and they hand it to me right before we start. I am here after a very long, full day. I'll try and do my best. I probably have more questions I didn't finish last week, so I'm going to start with where we were on the last week's questions. We do have a live chat here. As I see questions going on there, I'll try to defer to live chat whenever I see it first. So today is the 19th of September, Tuesday, 2023. If this is of benefit to you, we would certainly ask you to share this and like this and subscribe, please. This will help the channel. Even leaving a comment, even if it's just a small little word or two, because I do look at the comment section. So please like, subscribe, share, and leave a comment on every podcast or YouTube video that we do. That'll help this come out. And I am looking seriously into, with our team here, on adding an additional evening, because it looks like I'm not going to be able to keep up with all these questions here. But that's my desire, is to do that. Okay, so the first question I have is from the email list, and this is last week's that I didn't finish. Renee asked the question, I want to share my recent observation with you. I was in the hospital for a minor procedure and watched an hour and a half of TV while I waited in the inpatient room. Every single food commercial that came on was for fast food and diet soda. The only commercial that featured healthy whole foods was for a dog food commercial. I found this ironic and quite disheartening, to say the least. The cost of food continues to rise, and people are exhausted from working all the time. So I don't blame people for wanting to choose quick and easy processed meals, but obviously this does more harm in the long run. True, that's very true. What are some approachable ways for people who are tired, overworked, and living on a strict budget if they want to eat healthier and prioritize their overall health? My suggestion is to eat a one menu day, so that if you have tonight, let's say you're at home, you're going to cook, and you cook up hamburgers or steak, a meat. I would ask you to cook enough so that there's enough for breakfast and lunch the next day, so that you will have that food available 3 meals out of your one attempt at cooking. Same for lunches for the kids and breakfast. It's commercials that teach you that breakfast is cereal or some concoction of a different variety. No, we can eat steak and broccoli for breakfast and for lunch and for dinner. So I try and eat a one menu day, and the next day you could change it to chicken and a different vegetable, chicken and green beans, let's say, and make enough chicken and enough green beans so you can have it set aside for your breakfast and lunch. Third day, you could cook up salmon and asparagus, have enough for your dinner, then enough set aside for breakfast and lunch. And thirdly, fourthly, let's say you had some pork chops and Brussels sprouts, have enough made so you can have it for breakfast and lunch. So we call this here a one menu day. So you only prepare once a day. what some people do, and I've learned to do over the many years, is I tend to cook about every 2 weeks. And I cook with trays in my oven, and I'll put like 10 pork chops on it, and I'll, sprinkle some garlic, salt, and pepper. And then I'll get about 20 chicken legs or 12 thighs of chicken on another tray. Then I'll make up my hamburger, and I'll make little pound hamburgers, and I'll maybe have 12 of those or 16 on the third tray. And then the fourth tray, I put my thick bacon, and I can get about 2-3 pounds of bacon on a tray that way. I slow cook this at around 250 to 275 degrees Fahrenheit for about 2 hours. And then I have all this protein ready for me. I let it cool down, and I get my little baggies, and I put it in my freezer. Gets full of bags of pork chops, and bags of chicken legs, and bags of hamburgers, and bags of bacon. And I then have this, and I can take it out, and by the time it comes to lunchtime here, I can have this thawed, and it's quite tasty. I don't use microwave. You can get a little induction top cook thing in a pan or something, or a like a toaster, and heat it up. I don't like microwaving at all. So that's what I would suggest you do. That you set aside about 3 hours of preparation twice a month, or 2 hours once a week, and then get all your protein-based themes ready, and there you have it. And so that's how we would do it. Pamela says, what is the best way to detox after chemotherapy? Well, a low-carb diet, drinking half your weight in water as ounces. So if you're a 200-pound man, you would drink 100 ounces of water every day. I do think using high-dose vitamin C intravenously with EDTA chelation is an excellent methodology. Very often, many of these chemotherapies use a metallic carrying base, cisplatin. Platinum would be the heavy metal toxin that's involved. So also I would suggest never eating past, say, 5 o'clock in the evening, and only eat in a 4 to 6 hour window, so that your stomach is empty as long as it can be, and you're eating more on a carnivore type, very low carb. And taking on an empty stomach twice a day systemic enzymes, 5 Vitalzyme or systemic enzymes, Vascuzyme, on an empty stomach. You could use more enzymes. I've had some people take 8 or 10 twice a day. And take your vitamin D, probably 10,000 international units of D3 with K2 90 micrograms. Make sure you're on that every day. Use a good amino acid chelate, magnesium, potassium, calcium, selenium-based multivitamin. And then I believe in a powerful antioxidant we use here called Juice Plus. It's just the phytonutrients of fruits, vegetables, and berries, where all the starch and fruit sugars have been rinsed out. So you get the phytochemical concentrates of 30 different fruits, berries, and vegetables. And that is a core base of how we detox and go from there. Find yourself a good functional doctor who does high-dose vitamin C and intravenous chelation therapy with EDTA, and you'll be on your way. Constance says, hi, Dr. Rita. What do you do when do you do a 3-day fast? When you're not feeling well, or after eating foods you usually don't eat? Or what do you eat when you break the fast? And do you do the 3-day fast with water only? When I do a fast, I do it as a water fast, and I do allow myself my black coffee. I take all my vitamins as usual. The only one I don't use is the digestive enzymes, the orthodigestive enzymes, which I'm going to take another enzyme right now because I ate at 4 o'clock. I had salmon. So I don't take digestive enzymes when I'm fasting because I don't have anything to digest. So I do a water fast. I take my vitamins normally. I drink black coffee. I come to work. I don't change my schedule. I'm able to keep up with my trainer, my weightlifting 3 times a week, and my Pilates personal private instructor once a week. And that's what I do. When do I do it? I'll do a 3 to 5 day fast at least twice a year, every 6 months. If I feel ill at all, I just stop eating for at least a day and a half, 36 hours. If I ate something that upset my stomach, I probably will wait 24 hours. So that's kind of how I run my life like that, Constance. Amela, hi, Dr. E. When using EDTA chelation suppositories, are we supposed to drink more water like with the EDTA chelation IV to flush the toxins out? If so, how much for a 140-pound female? No, I think if you are drinking half your weight in pounds as ounces of water every day, you're getting plenty. And so you're going to do just fine, whether you're using the suppositories or you do the IV. We get into these little mantras, but most people are not drinking half their weight in pounds as ounces of water every day. So try and do that all the time. John says, is A2 half and half better for reduced inflammation than standard ultra-pasteurized? I think what John is referring to is there are cows that are genetically bred to have different parts of the beta casein 1 or beta casein 2 proteins made, and they differ. The cows differ on also making lactose as well. So there's a series of Jersey versus another kind of cow. I forget the name of the cow, but these are breeds of cow production that are trying to modify some of the proteins and sugars that are made in the cow's milk. I am not convinced that we have enough research on this that we can make strong recommendations either way. The only recommendation I make is that if you do dairy, that you try and avoid pasteurization and homogenization, because these processes are rather new to mankind's history. I think in the past 100 years, we started doing homogenization and pasteurization. And these are abnormal treatments to the cow milk. With it, it has created a lot of inflammatory changes to the structure and molecular makeup of the cow dairy, so that when we consume it, we are taking in inflammation from the dairy because of the process of shaking it up through homogenization and the heating it up, which busts up the matrix of the proteins and fats and sugars and some of the cellular debris, as opposed to the natural room temperature or cool dairy that would come straight from a healthy, clean farm, which all mankind has had up until now. So it's a long topic, and I just stay away from any store-bought dairy or cheese that is from homogenized or pasteurized sources. I just avoid it, and I try and stick with I go to Sprouts if I buy cheese, and I get it from Organic Pastures. And I've been to their farms, and I've had him come and speak to my clinic here. I should do it again. Christine says, what supplements are beneficial to women with mild osteoporosis who cannot use hormone therapy and are unable to walk? All right, so the focus then would be a very low carb diet, eat like a carnivore, and to use enough vitamin D with vitamin K2, so vitamin D3, probably 10,000 international units with K2 is what I use as a standard routine, 90 micrograms once a day. And after a month or two, I test the levels. If I don't see the vitamin D level up to about 100 micrograms per deciliter, then I increase by 5,000 international units of the vitamin D with K2 until I start seeing the vitamin D levels hover around 100, 120, always checking the chemistry, liver enzymes. And I've really never seen a problem ever in all these decades. So that's what I would do, be very low sugar, eat all that healthy protein and healthy fats, and do what exercise you can do. If you can't walk, then I would do some calisthenics, weight training, Pilates, that kind of a thing, and go from there. The next question is Alexis. Hi, Dr. Ellithorpe. I'm one of Dr. Meric's patients. I was just listening to a podcast the other day by a female physician from Harvard whose medical paradigm seems to align with yours. She's also very focused on longevity. For women, her number one recommendation is to get a CT scan of the chest to assess your coronary artery calcium score. I think that's reasonable. But I think doing it much before age 60 is probably increasing the coffers of the facility rather than really getting where disease is. See, I want to prevent the disease, so we don't need these kind of tests. But certainly by the time you're postmenopausal and without hormones, maybe at 55 it would be reasonable. But women who are healthy and exercising, low carb, drinking their water, taking natural hormone replacement therapy and on systemic enzymes and vitamin D with K2, these are women I'm not worried about. If their insulin is under 4 fasting and their fasting blood sugar is under 85 and their triglycerides are in the 60s, 50s range, and their hemoglobin A1C is 5.2, it'd be almost impossible to see heart disease in that group. So it's a good thing to do, but I think if you help your patients and work with them to live healthy, then they will do well. She went on to say, I have preventricular contractions and have experienced atrial tachycardia a few times. What are your thoughts on this test? So in that case, Alexis, if there's symptomology, I don't see a reason not to do it. Is this something that in theory a TLC practitioner could prescribe? Absolutely, we do prescribe it. I've ordered many, a coronary artery calcium score. Based on your previous live streams, I'm becoming more interested in chelation, and I know you'll probably recommend that too as well. Most definitely, I would recommend that for micro circulation that gets the vitamin D and K2, better penetration, better tissue oxygenation, less free radicals, better perfusion, less inflammation. It's better every way you look at it. Manja says, hi, Dr. E. My dad is 79 and he got shingles. It started on his right leg, so he can't put any shoes on. His leg is swollen. It has already been 2 months. Anything you would recommend for that? Thank you. In general, anytime you have these limb inflammations with a shingle, taking systemic enzymes is very, very valuable. Taking Optimag Neuro, a magnesium powder drink with vitamin C is very helpful. But systemic enzymes and vitamin C powder with magnesium powder, and you could bring them into the clinic and as a walk-in and get a low dose of vitamin C. I mean, it's high dose relative to anything else, but you could get, I think, a 12.5 gram, which is huge, intravenously as a walk-in, and maybe you could see one of the doctors here with him. Then I see some questions showing up here. Um, IUWA says, how do you fix constantly having bloodshot eyes? Well, obviously, the circulation to the clear covering to your eyes is irritated by something, and so they're dilating. Usually, this is from allergens, could be viral, could be microtrauma from rubbing it from allergies all the time. So there are many causes. You would want to look at your work load situation. What kind of job do you have? What are your exposures? How old are you? Are you postmenopausal? Are you an older man? But allergies are the number one thing. And I tend to use, and I have it right here because I do this, because as I get to menopause and I'm drying up, my eyes dry up. So I use Argentine Silver. That is a broad spectrum eye drop uh, for antiviral, antibacterial, antifungal. And I'll just moisturize my eyes with a drop. And my son Talon has bad allergies. He got it from me. I take quercetin. I take 400 to 600, sometimes even 800 milligrams at a time. Sometimes you need to use Zyrtec or Allegra, which are two over-the-counter non-sleepy antihistamine, mast cell stabilizing prescriptions. And so all those things are what it, be well hydrated, but this is what I would do. Robert says, I get twitching muscles on my chest. You can see it twitching. I take lots of magnesium for bowel softness and drink lots of water. Do you know what causes this? Probably B vitamins. I would take the TLC methylated B complex and take all four once a day and see if this stops. As we age, our water soluble B vitamins diminish, and they're so important in so many functions of the body and electrochemical signaling. So that's what I would do. Robert goes on to say, if a pill falls out of your prescription bottle onto the counter, does that mean your medicine is counterindicated? Yes, it's counterindicated, Robert. Thank you for your being a part of this TLC Health Freedom Tribe and bringing your humor, because that's an immune booster. Thank you so much, Robert. Let's see. Christina says, hi, Dr. Rita. Hope you're well. I ate out last week and started feeling nauseous that night and bloated. I've had loose stools about 3 days now, on and off bloating, nausea. Are there natural remedies? See, here's a situation where I would stop eating. The minute I'm nauseous, your body can only tell you in soft ways, especially through the vagal nerve innervation of the stomach. These aren't somatic nerves that pinpoint that, ouch, you hurt your fingertip. It's very different for abdominal pain indicators. So nausea is one of these things. So just stop using the work of your stomach and go on a fast for 24 hours. Just have chicken broth and beef broth, and you can take ginger ale with some water mixed in it if you're so unable to handle being without food. You could get the glucose in from ginger ale. Mix it with water to get the fizz out, though. And just rest your bowel for a day like that, or 2 days. You know, that's how I would do it. There are other things to do, but if that doesn't fix it, you should be probably seeing your doctor. Let's see. American Visualist, thank you for your valuable time and knowledge. Well, God bless you. Thank you so much. All right, RMJ, you missed my question, which was the first question. Oh, okay. Oh, there it is up there. Thank you, RMJ. What might be the cause of a low oxygen level 80 following a successful cardiac ablation 2 days earlier? Well, number one, you should be telling your cardiologist about that. The getting microclots, I don't know if you had the injectables from the mRNA and stuff, but the spike protein and microclotting, inflammation, endothelial lining could be a issue. Not drinking enough water would promote microclotting. So you need to let your cardiologist know. And if it's sustained at that level, you should be probably having symptoms. But do go and have that checked out immediately, because a normal oxygen level on those little finger saturations should be 95, 96 range. And that needs to be addressed, RMJ. So what we do here is we do EDTA chelation for things like that. We give them systemic enzymes on an empty stomach, 4 or 5, at least twice a day, if not 3, 4 times a day on an empty stomach. Push a lot of water, fast for a day or two to give, like the Pac-Man, chewing up little microclots, and that should help. Taking magnesium, which helps relax and dilate the blood vessels and the smooth muscles. All these things help. Of course, if you smoke or vape, please don't do that. And there you have it. Oh, she is in the hospital. Okay, so this is not you. All right, RMJ, then I would, talk with the doctors there, and it sounds like it's some form of this, find out about injectable with the mRNAs, and find out if she's on blood thinners. Usually they're doing 2 and 3 triple therapy anticoagulants. You could be on a baby aspirin. Sometimes they'll give Eliquis and something like Anestro or something. So triple therapy, lots of water, and so forth. Yes. All right, let's go back to these here. James says, Dr. Ellithorpe, I had one ablation March 22nd, 23. It lasted for 2 months. Now I deal with atrial fibrillation once again. The doctor wants to do another one in November. At the moment, I took myself off of Eliquis and metoprolol, and I do go in AFIB on and off. Ever since I had the ablation, I notice when I go into AFIB, my heart rate goes to 150 range, and the blood pressure a little higher, 155/88. So I went in AFib today from 9 until 10, and this was back last week. This is one of the questions I didn't get to. And it lasted about an hour. Do you recommend another ablation? I've only seen really good results from ablations, James. I think they've really turned this into a very interesting and evaluated science. So these electrophysiological cardiologists are doing a very good job. So I would be. Now, of course, we would metabolically want you to be as healthy as you can and do EDTA chelation to improve the microcirculation. So hopefully you never go back into it. If this works the second time, he wants to do the Watchman. What do you think about the Watchman as well? That way I won't be on Eliquis and metoprolol. Right now, I suppose I'm supposed to be on both. I was on it for most of the year. I got off both. When I did, I had a reaction. 5 days later, my blood pressure went up for several hours, and it went back into sinus rhythm. I'm doing good now. Any advice would be appreciated. Thanks. Thank you. May God continue to bless you and your family. Take care. Love and miss you dearly. Well, thank you, James. My suggestion is, I don't know who you are. You have to work with your cardiologist and talk with him. I do think it's important to be following their medical management in between ablation, being on the blood thinner, and the metoprolol is a beta blocker that helps the rhythm so it won't easily be triggered back into atrial fibrillation. So living healthy, and what is living healthy? It's trying to keep these membranes here, this bilipid double membrane of the cell wall, healthy like this picture, and not with holes poked in it from free radical oxidative stress. And what creates free radical oxidative stress? The American diet, full of carbs and starch and sticky sugars and microclots and endothelial lining irritation, shear factor damage to the endothelium. This shearing will disrupt, the glycocalyx, which is the little tiny like hair along the cells. It's just terrible what a high carb diet does. The high fructose corn syrup, not drinking enough water, always drinking to think you're supposed to have an entertaining fluid instead of real water. And then the inactivity, we're not exercising, we're not moving, and we lose enzymes with aging. And then our hydraulic pressure, you might say, the pumping of rhythmic exercise and so forth is diminished. So capillaries collapse and blood flow diminishes, cells get stressed and start to die, and you get cytokine inflammation. It's a cycle of death. So we ask people to be ketogenic, very low carb, or go carnivore. We ask them to do the EDTA chelation therapy, follow their cardiologist's instruction on the medications, and even the ablation. And we ask them to exercise as they are able to, because I don't know your situation or what they're associating with the AFIB. Some people have this after an injury to the heart, from a heart attack, ischemia, infectious viral pericarditis, post-MRI injection pericarditis, whatever. So you have to have a healthy lifestyle, and the EDTA circulation most definitely will help the microcirculation, reduce the inflammation, increase the oxygenation, and the systemic enzymes on an empty stomach 5 twice a day will help reduce the same thing and get rid of debris. And it's just a whole process like that. You have to eat the protein and fat you're made of, because these cell membranes, if they're going to fix that hole right there, you have to eat the phospholipids and the meat, fish, chicken, egg yolks, and all that kind of stuff. So yes, sir, follow with your doctor, do those things, find a good doctor that can help you with the other functional things that we do here. Next thing is Kathy. Kathy, what is the recommended amount of zinc to take to prevent illnesses? Well, most multivitamins are designed to have about 5 or 6 milligrams of a amino acid chelated zinc in it. Zinc picolinate, zinc glycinate, about 6 milligrams a day. Now, if you take more than that, and I think she goes on to say, would taking approximately 65 milligrams daily for about 2 years be cause for concern? It can, because if you have excess zinc, then you can get a copper deficiency, and that's a whole nother topic about mineral balance. And so that's why it's good to have a experienced functional doctor who has some bearing on these things, so you don't do foolish activities. It's not harmful to take zinc 25, 50 milligrams a day for a month, let's say healing up from a bad cold, pneumonia, illness, or viral illness. But then I would drop back to the 5 to 10 milligrams a day. And the functional doctors know how to do intracellular and extracellular serum samples for copper and zinc if it's necessary. I rarely ever need to do that, but that's what I would tell you. And Stacy says, are you seeing more bone problems since 2020, like abnormal bone growth and or cataracts? Stacy, I'm seeing almost everything more than I've ever seen in 42 years of practicing medicine. And I do associate it with some interventions that have been forced upon us, and they have not been studied well enough, reported on well enough, and their physicians haven't protected the sanctity of the doctor-patient relationship and the freedom of medicine and the freedom of transparency. So yeah, I see almost everything more in the last 2 years that I've ever seen in my life. Now, is it bone growth or cataracts? I'm not going to say that's jumping out. I'm going to say I'm seeing more pericarditis, more cardiovascular clotting, deep venous thrombosis, pulmonary embolisms, hypertension, these kind of things. Okay, Leah says, good evening, doctor. I'm 53, had a hysterectomy laparoscopically done when I was 35 due to fibroids. heavy menstrual cycles, and bad cramps. I kept my ovaries, but almost immediately started having menopausal symptoms. Maybe like 4 or 5 years later, I started having abdominal pain. They went in, they discovered I had endometriosis, really bad. Cleaned it all out and removed my left ovary. I felt much better. I eventually went on bioidenticals for menopausal symptoms. I had been on them until the last 6 months when we moved, and I didn't know if a compounding pharmacy and went on synthetic progesterone and patch estradiol. I have for the last about 2 months started having abdominal pains with a heavy feeling like when I had the endometriosis before. Could I have it again? It's possible, even though I am postmenopausal. Well, you're postmenopausal, but on hormone replacement therapy, which is the same signaling that's in the environment of being younger when you had endometriosis. And if so, can it be treated without surgery if I do? Could it be because I got off the bioidenticals? Thanks for whatever information you have. I hope I gave you enough. God bless. Well, in general, and she says that you love Priya Patel, Dr. Patel here. Yes, PA Patel, Dr. Patel is a wonderful healthcare provider, a true hero in the field. So Leah, a high carb diet is felt by most functional physicians to be the cause of polycystic ovarian syndrome, hyperinsulinemia, hypertriglyceridemia, hypertension, and then the multiple endocrinological problems that go along with this abnormal hormonal drive from eating too much bread, starch, pasta, bagel, crackers, pie crust, inflammatory foods, lectins, genetically modified, and all that insulin stimulates growth. Remember, estradiol is a growth promoting hormone, but in a rhythmic fashion. And so we have to have growth hormones to repair our tissues, to repair blood vessels. We're always remodeling. So God always has some hormone effect going on in men and women. And when we eat a high carb diet and have hyperinsulinemia and get insulin resistance, and we still have these hormones, or we take them extraneously, we can drive the insulin along with the hormonal impact and get these problems. So we would have you go on an extremely low carbohydrate keto diet, carnivore diet. We're talking at least 3 to 6 months. We would have you immediately go carnivore, maybe at least the first month, to dramatically improve everything. We would find out your blood type. We would give you systemic enzymes, again, 3 times a day, to chew up all that inflammation and material. We would have you drink half your weight in ounces as pounds, your weight as pounds in ounces of water. We would have you do aerobic exercise and some resistance training. And then we would give you magnesium multimineral vitamin, and we would probably give you the iodine, a 12.5 milligram iodoral. We'd probably give someone like that a antioxidant like Juice Plus. And then we would probably reassess from that point. You need to have a pelvic exam, ultrasound, looking at things like that, find out when your last colonoscopy was, find out what's going on there. All these things with your doctor, Leah. So please see your doctor and go over that with whoever they are. Megan says, what are your recommendations for low omega-3 levels? Omega check test came back at a 3.7. Thank you. I don't trust these fatty acid levels. Most doctors didn't practice major in chemistry, biochem, and fatty acid research is a very hard science, and assays for the various fatty acid double, triple. There's 5 double bonds. In DHA, there's 6 double bonds, and EPA, and these aren't essential fatty acids. Linoleic has 2 double bonds. Alpha linoleic has 3 double bonds, those are the only 2 essential fatty acids we must have. And God gives them plentifully in egg yolks and meat and fish with chicken and the skin with it. So if we ate a natural diet and got away from all this carbohydrate, we would be getting enough fatty acids that are essential. Remember, the parent fatty acid we must eat, consume, is linoleic and alpha linoleic acid. Omega-6 is linoleic, that's a 2 double bond fatty acid, and alpha linoleic is a 3 double bond. These are the critical 2 that we must have. They've known this since 1929. Dr. Burr and his wife were both biochemists. This was during the greatest phase of medicine and nutritional research in American history. And disease and death is associated with deficiencies of these both. Now, all the EPA you want, all the DHA you need, you can make downline using the delta desaturase enzyme pathways. So am I going to worry about $100 tests and trying to get authorization and waste my time with dumb insurance businesses that don't practice medicine or care about the patient? No, I'm going to tell you to eat right. I'm going to tell you to exercise. I'm going to tell you to drink your water. I'm going to tell you to not eat late, to use enzymes and those kind of things. So I don't care about these omega-3 checks. I don't trust them. Because oxygen combines with these double bonds, and that's what aging and rancidity is all about. So no, eat the healthy, rich meat, fish, chicken, turkey, beef, eggs. Take a double dose every day. Become a carnivore for 3 months and watch. Do the, for a joke, whoever ordered that omega check, do it after you've been a carnivore, eating free-range wild-caught food for 3 months, and watch the level go up. Harlow says, blessings, my beautiful sister in the Lord. Well, thank you, Harlow. Were you able to check on spironolactone for your blood? Yes, I did. You are my teachers. You guys help keep me educated and on my toes. Yeah, spironolactone is a potassium-sparing diuretic, and it's used in preventing all kinds of cardiovascular hypertension, some heart failure, things like that. And the potassium sparing is very important because losing potassium is part of the imbalance on the cell membrane surface that has that action potential. If you have enough sodium rush in, potassium rush out, chloride, that electrical charge on those opposite molecules of salt are going to trigger a electrical change, which will propagate down the cell, and you get contractions of your heart and muscles and thinking and all these wonderful processes that God has designed. Then when you get more cell damage, like in a picture here, as you age, then you're going to have more opportunities to have these electron potentials mess up and get all these kind of problems, heart failure, irregular heartbeats. So that's why all my patients are super healthy. We're fixing our holes. We're plugging them up by eating our meat, our fish, our chicken, our egg yolks, staying low carb, doing chelation therapy, and we don't have to worry so much about potassium sparing blood pressure pills like spironolactone. Okay, if you have to use a blood pressure medicine, which one has the least side effects? What about clonidine? Clonidine is a central acting, more in the central nervous system, alpha blocker, I believe, and it's a relaxer. It's very, very, very potent. It also has been told to be like a relaxer, a anti-anxiety medicine. So I would find out with your doctor. The discussion is what's your age, what are the other issues going on in your life, and these blood pressure medicines, can be chosen more uniquely designed to you and your age, your situation, what other medicines you're on, how active or not active you are. So you have to work that out with your doctor. I think they're both useful and they both have a point. But you see here, we would ask you to drink enough water, exercise, be low carb, take enzymes, do some chelation therapy, to reduce oxidative stress, heavy metal toxins, and improve your microcirculation. So we do that all together, Harlow. God bless you. Sharon says, I so appreciate your content. I have a question for you. What is up with all these gums and foods like Guar Gum, Acacia Gum, Carob Bean Gum, etc.? I have noticed a big uptick of them being put into foods that were never there before, like adding it to coconut milk when coconut milk on its own is just fine. I've had a hard time finding a good source for explanation of these gums. Are any gums safe? Well, these are plant products, and they are some of them are polysaccharides, which are just sugars all chained up together. And these are like a fiber. You get them from mostly from, I think, the seeds of like the cacao seeds. So you're getting these extracts from seeds, which act as a fiber, and some of them act like a emulsifying. It helps the smoothness and the uniformity of the liquid to be dispersed. So it'd be like in milks and ice creams and tapioca and custards and yogurts. It's a fiber, and yeah, you can overdo it, and you could maybe get some gas and bloating from it. These are plant foods, of course. So, but a small amount of guar gum or something as a stabilizer put into a vitamin for the capsule to be stable, and uniform dispersal of the nutrient, I think is very minor. Okay, Doreen says, I got cataract surgery and I got a stubborn infection on my eyelid. The surgery was on July 11th. Now it's September 12th. I'm on an antibiotic number 4, and it's still not gone. The swelling goes down, the medicine ends, then a week after, the swelling returns. I'm now also taking Zyrtec and Tylenol. My other eye is fine. I see very well. I am very healthy. Is there something else I could take that will help it? Doreen, I think I saw you asked this question before. It sounds familiar. I would use Argentine silver. Again, the very same liquid that is in these droppers. You could put right onto your eyelids. In fact, you could spray this on your face. I'm wondering if you're putting some makeup or topical or something there. Taking a high dose vitamin C drip, taking a vitamin D, checking your vitamin D levels to make sure your vitamin D is in the 80 to 120 range, along with a chemistry liver enzyme check. Checking your insulin, triglyceride, glucose, hemoglobin A1C, checking doing microcirculation with EDTA chelation I do an enhanced version of that with vitamin C in it and the Argentine, and be extremely low carb. And that's how I would work it out with your doctor. See your doctor about that. But yeah, I would use the Argentine, and that is only available to doctors. So if you don't have a functional doctor that has Argentine 23 on it, because this is only from doctors, I would go to the health food store. I think it's called Sovereign Silver. Sovereign Silver. It's half the strength, but it's still very good. Okay, Tara says, Dr. Rita, would you recommend choline supplements? Also, what have you found best to help your patients quit smoking cigarettes? Thank you. Well, choline is part of a fat moiety that sticks on to like phosphatidylcholine. These are parts of these little items here, these phospholipids that are hanging like this on both sides like that. And this choline would stick here and these are specialized fat moieties. There's a lot of choline in egg yolk. If you eat your meat, your fish, your chicken, pork, your chicken with the skin on it, your shrimp, your crab, your lobster, you're going to get abundance of choline, and you're going to be able to fix little holes and have healthier brain and skin and eyeballs, and everything will be better in you if you eat what we're made of. We're made of protein and fat, not fruits and vegetables. Fruits and vegetables have wonderful micronutrients in them that are very useful, but they also contain repellents for the world, like lectins of all kinds of sorts to repel insects, molds, and bacteria and being eaten. And so if you eat plants, you're going to expose yourself to these things. And genetic modification now and glyphosates, and God only knows what they're doing. And this industrialized farming, making the plants less nutrient dense. So I'm not against eating fruits and vegetables, but I have found wild caught, prairie raised meat, fish, chicken, beef, and eggs is all I really need. And then I use Juice Plus for that. So get your choline, get it now. What kind of a supplement? We have the we created, but with the help of the Lord, because there's nothing that God didn't create. We're not inventors. He gives us witty inventions. But these phospholipids help make up this stuff here. Whenever I get a really bad stomach upset, these powdered fats and are helpful in the cell membranes, like with the lady with her eyelid infection, or if you have heartburn or any part of your human body, you got to make it out of what you're made of. So that's what you need to do. Let's see. Yeah, so I would use choline, and acetylcholine is having another, three-pronged kind of a carbon chain stuck to the choline molecule, and it acts as a neurotransmitter. I mean, God is very efficient, and he makes these molecules have many functions, many things that are needed in the nervous system, and this acetylcholine is felt to be helpful with nicotine receptors and calming them down. So, the more you are satiated by eating the healthy fats and proteins from a more carnivore diet rich in choline, the more calm I think you can be and get away from sugar addictions and nicotine addictions, all addictions. All right, what's the next question? Esther, I live in Europe. Oh my goodness. Okay. The hormone treatment is frowned upon here. I had my estrogen and progesterone creams that I have been purchasing, and I use them topically for a few years. A month ago, I developed vaginal bleeding, and that's after 10 years of postmenopause. They did imaging and said because I have been using estrogen, I developed thickening of the walls of the uterus, and some cases call for a more complex procedure called a diagnostic hysteroscopy with dilation and curettage, a D&C. I came here to have a second opinion and had not had a chance to see an OBGYN doctor. My question to you, at my age of 61, thinning of the walls, not thickening, and moisture versus dryness, typical or not. My bleeding lasts a week and stops. Should I continue taking topical hormones and get more naturopathic treatments or do the procedure? I am also concerned if it could be cancer, and no examples have been taken to the lab yet. I mean, I think she said biopsies or samples. Yeah, Esther, you need to get an endometrial biopsy. Estrogen normally thickens the lining of a young woman up to about 15 millimeters, 14 millimeters, and of thickness, so a centimeter and a half. And that's about the biggest it gets. And then when the progesterone cycles, it triggers the cleaning out of the lining, and you have a menstrual cycle once a month. So every 2 weeks you ovulate and you build up the progesterone. The progesterone then cleans it out, and you have a clean out once a month. That's the normal cycle. Estrogen does cause building up of the lining. Whoever is prescribing these hormones should be supervising you and checking your blood levels and asking you periodically to do a pelvic exam, sometimes a pelvic ultrasound to check on this. And that's what we do here. We put people on a low carb diet and enzymes so that we don't get excess thickening of the lining of the uterus. So although this can be normal, since this is the first time in 10 years, see your doctor, do the procedure, get the biopsies, make sure there's no endometrial cancer, check your levels, get yourself under the care of a doctor who's familiar with natural hormone replacement therapy and manage you with routine checks annually, and and check your levels of your hormones and make sure you're on progesterone, either continuous or cycled, and just get a good doctor that will follow you through, but do obey them and follow up. Perry, would you tell us the difference between EDTA, disodium chelation pills, and intravenous chelation therapy? Well, you can put the molecule ethylene diamine tetracetic acid in a pill form. You can swallow it, but it's such a big molecule, it's not going to be absorbed through your gut into your body and where it needs to be to help pull out stuff. And you can only get a tiny, tiny amount in. So its impact is going to be largely very low effect, minimal. Now, all food and water and air that we're breathing in has contaminated dust, and the geostratospheric engineering, and they're putting nanoparticulate material in there to create these metallic clouds and bounce waves off of them and stop the sun from getting through. All this research is being done for decades and decades, and this falls eventually on the ground. You walk on it, the cars, the wind blows, and we're breathing it in all the time. So we cannot get away from this heavy metal. That's what we need to address. So I think taking oral could possibly be a little bit of value to the food that you ate, because it grows in the ground up into the fruits and vegetables. The animal eats it, it gets into their tissues. But the only meaningful way to get real detoxification and reduction and reproducible measurements is with intravenous ethylene diamine tetracetic acid, calcium disodium EDTA. All right, next one. Let's see if we have any live ones here. Tell me more about strong PGC1 Alpha activators. All right, well, I don't, that doesn't ring a bell in my brain, so I am going to have to tell you, Jesus, I've got to look that up. PGC1 Alpha activators. You must be in the world of science or a medical student, a new drugs, and I will look that up. Okay, so this is JEWSUS. All right, so I can't answer that question. What is the best way to remove amyloid brain plaque? Well, there's an argument over this in the research. We do think this is more related to sugar metabolism and the brain dendrites that act like macrophages to this microscopic injury, inflammatory reactions from heavy metals, chronic viral illnesses, things that ought not to be in the brain, fructose excess, and it's like a immune reaction, and this builds up. So we believe that a cardiovascular EDTA chelation will improve microcirculation, reduce oxidative stress. Taking systemic enzymes will also help, like Pac-Man, eat up the debris cells, and being extremely low carb on a carnivore type diet or a very low ketogenic diet will facilitate a relaxation of the dendritic cells in the brain tissue itself. The membrane surface will be repaired to the nerve sheath, myelin sheath in the brain cell by eating more phospholipid-rich egg yolks and cells like that. So that's how we would begin on that. All right, so I am woefully late. So here's what I want to say. I have to go to 2 days a week after work. So because I'm not even finished with the 12th. I have this one page I didn't get to. So I'm going to ask you to be on alert for our news. We'll put out a bulletin. I'm going to have to go to 2 days to do this because I love doing this and I don't like to be rushed because I enjoy doing this. So I will probably, we're doing this Tuesdays, probably Mondays would be the time that I would most likely do this. So there you have it. We're so busy. We have so many wonderful people like you that we are now in a situation where I got to do more work. But I like doing it, and I hope it's a blessing. And I hope our rising tide brings all the boats up. So if we teach and we walk the walk and we talk the walk, then maybe we can. Uh, American Visual. Do you know if Dr. Meryl Nass's medical license was reinstated? I don't know if it was. She helps write for brownstone.org. They had a wonderful article that came out today on the foolishness of masking and whatnot. So that came on brownstone.org. It's an excellent source for science, politics, all that kind of stuff. It's a constitutional republic, kind of conservative melting pot of all the sciences and disciplines. She writes for them, but not exclusively. She also helps with children's health defense, and I think works with the lawyer, what's his name, with Del Bigtree. But anyway, I don't know American, but we got to pray for her and doctors like her. So I've got 4 pages I didn't get done, so I got to do another day. Let's plan to do this Monday nights, and we'll just have a ball, and we'll just keep on doing this, and we'll go from there. So in the meantime, the Lord bless and keep you. Take care of your wonderful body. The Lord, you've been made in the image of God for his pleasure. So let's bring him glory and go from there. So good night and take care. Read your Bible. Go to church. Okay. Bye-bye.